Welcome to CPR and First Aid Anywhere, presented by the American Heart Association. Today, you'll learn some very important skills. You may not think you'll ever need to use these skills, but people just like you have saved lives with CPR. Now we're going to discuss common emergencies and what you can do while waiting for help to arrive. However, not all topics are covered in this video, so it's important to be aware of situations where you may need additional training. Topics we'll cover include how to recognize and help with bleeding and bandaging, stroke, heart attack, fainting, diabetes, seizures, and opioid overdose. Bleeding can quickly become life-threatening if not controlled. Severe bleeding occurs when a large blood vessel is cut or torn. When this happens, a person can lose a lot of blood within minutes. Minor bleeding occurs from small cuts or scrapes. Most bleeding can be stopped with pressure. It's important to stay calm. Bleeding often looks worse than it is. For minor cuts, wash the area with soap and water, and then apply a dressing to the wound. To stop severe bleeding, take the following first aid actions. First, send someone to get the first aid kit. While you are waiting for the first aid kit to arrive, have the injured person apply direct pressure to the wound. If gloves are in the first aid kit, use them. Once your gloves are on, apply dressings from the first aid kit and put direct pressure on the dressings over the bleeding area. Use the flat part of your fingers or the palm of your hand. If the bleeding doesn't stop, you'll need to add a second dressing and press harder. Do not remove a dressing once it's in place, because this could cause the wound to bleed more. Keep pressure on the wound until it stops bleeding. Once the bleeding has stopped, or if you can't keep pressure on the wound, wrap a bandage firmly over the dressings to hold them in place. But what if the cut is much deeper, and after you've applied pressure and dressings, the bleeding doesn't stop? The first aid kit may contain a pre-made or manufactured tourniquet, which consists of a strap that you wrap around the injured person's arm or leg and a straight stick-like object called a windlass. The windlass is used to tighten the tourniquet. If applied correctly, a tourniquet should stop the bleeding. If you don't have a tourniquet, you can make one. Fold a cloth or bandage so that it's long and at least 1 inch wide. Wrap the bandage 2 inches above the injury if possible. Tie the ends of the bandage around a small hand tool, stick, or something similar. Turn the item to tighten the tourniquet. Continue tightening until the bleeding stops. Stroke is another medical emergency for which you may need to use your first aid skills. Strokes occur when blood stops flowing to a part of the brain. This can happen if a blood vessel in the brain is blocked or leaks. Many people can be given treatments in the first hours after a stroke that can reduce the damage and improve recovery. Therefore, it's important to recognize the signs of stroke quickly and get medical care fast. You can use the FAST method, which is a simple way to remember the following warning signs of stroke. Face drooping. Does one side of the face droop or is it numb? Arm weakness. Is one arm weak or numb? Speech difficulty. Is speech slurred? And time to phone 911. If someone shows any of these symptoms, phone 911 immediately. If you see these signs and think someone is having a stroke, take these actions. First, phone or have someone phone 911. Next, note the time when the stroke signs first appeared. Remain with the person until help arrives. If the person becomes unresponsive and is not breathing normally or is only gasping, provide CPR. Earlier, we talked about the difference between a heart attack and cardiac arrest. When a person is in cardiac arrest, she needs CPR immediately. When a person has a heart attack, his heart is still beating and he needs a different kind of help. One of the main signs of a heart attack is chest discomfort. Most heart attacks involve discomfort in the center of the chest that lasts more than a few minutes or that goes away and comes back. It can feel like uncomfortable pressure. squeezing, fullness, or pain. Discomfort may also appear in other areas of the upper body. Symptoms can include pain or discomfort in one or both arms, the back, neck, jaw, or stomach. Other signs of a heart attack include shortness of breath with or without chest discomfort, breaking out in a cold sweat, nausea, or lightheadedness. If someone has signs of a possible heart attack, do the following. Make sure the person stays calm and rests. Phone 911. Ask someone to get the first aid kit and an AED if one is available, in case the person does go into cardiac arrest. Many first aid kits contain aspirin. If the person has no allergy to aspirin, no serious bleeding, and no signs of a stroke, have him chew and swallow 1 adult or 2 low-dose aspirins. If the person becomes unresponsive and is not breathing normally, be prepared to provide CPR and use the AED. Remember that during a heart attack, giving aspirin appropriately can make a big difference in the person's quality of recovery. Fainting may occur when someone stands without moving for a long time, especially if it's hot, has a heart condition, suddenly stands after squatting or bending down, or receives bad news. Fainting is a short period of time when a person briefly stops responding, usually less than a minute, and then seems fine. A person who faints usually gets dizzy and then becomes unresponsive but is still breathing. If you're asked to give first aid to a person who is dizzy but still responds, help the person lie flat on the floor. Seek medical help or phone 911 if the person doesn't improve or becomes unresponsive. If a person faints and then starts to respond, ask the person to continue to lie flat on the floor until he can sit up and feels normal. If the person fell, look for injuries caused by the fall. Seek medical help or phone 911. Signs of low blood sugar can come on quickly in someone with diabetes. Low blood sugar can occur if a person with diabetes has not eaten or is vomiting, has not eaten enough food for her level of activity, or has injected too much insulin. If low blood sugar occurs in a person with diabetes, the person may become irritable or confused, hungry, thirsty, or weak, sleepy, or sweaty. Or the person might even have a seizure. If you suspect that someone has low blood sugar, take the following first aid actions. If the person can sit up and swallow, ask her to eat or drink something with sugar that can rapidly restore blood glucose levels. These items include glucose tablets, soft chewy candy with sugar, orange juice, or whole milk. If the person can't sit up or swallow, don't force her. Have the person sit quietly or lie down. If the person does not improve within 15 minutes, phone or have someone phone 911. A seizure is abnormal electrical activity in the brain. Most seizures stop within a few minutes and are often caused by a medical condition known as epilepsy. But seizures can also be caused by head injury, low blood sugar, heat-related injury, poisoning, or sudden cardiac arrest. During a seizure, a person may lose muscle control, fall to the ground, or stop responding. And the person usually has jerking movements of the arms, legs, and sometimes other parts of the body. However, not all seizures look like this. Some people might have a glassy-eyed stare and not respond. During the seizure, a person may bite his tongue, cheek, or mouth. You can give first aid for that injury after the seizure is over. And after a seizure, it isn't unusual for the person to be slow to respond, be confused, or even fall asleep. The most important first aid action for a person having a seizure is to protect the person from injury. Move furniture or other objects out of the way and place a small pad or towel under the person's head. Contrary to myths you may have heard, if someone is having a seizure, you should never hold him down or put something in his mouth. Then, phone 911. After a seizure, quickly check to see if the person is responsive and breathing. If the person is unresponsive and not breathing normally or is only gasping, provide CPR. Stay with the person until help arrives. If the person is having trouble breathing because of vomiting or fluids in his mouth, roll the person onto his side. Across the United States, far too many people are dying from drug overdoses. These deaths are largely due to opioids such as morphine, fentanyl, heroin, oxycodone, and hydrocodone. Opioid overdose can lead to cardiac arrest. That's why it's important for you to know how to respond to this life-threatening emergency. This section covers the special situation of known or suspected opioid overdose and the availability of naloxone. You are likely to encounter the person with the overdose in a home or isolated location where other equipment such as an AED is unlikely to be present. It's important that you know how to respond. There's a safe and effective way to help someone with an opioid overdose. Naloxone is a medication used to reverse the effects of an opioid and help the person to survive. If you know of someone who has been prescribed naloxone and you are familiar with or have been trained in the use of naloxone, you may use it to save a life. Common signs of opioid overdose include unresponsiveness with shallow or slow breathing or even no breathing or only gasping. You may suspect opioid overdose if you see signs of the drug nearby or there is other evidence of drug use. If you suspect someone has overdosed on an opioid and the person is unresponsive but still breathing, shout for help, phone 911, and stay with the person until help arrives. If the person is unresponsive and not breathing normally, give 5 cycles of CPR with breaths and then phone 911 and get an AED if there is one nearby. After phoning 911, give naloxone right away and then assess the person's responsiveness. If the person is still unresponsive, continue CPR and use an AED if one is available. In situations where you suspect an opioid overdose, the American Heart Association recommends performing CPR with breaths. In this program, you're going to learn how to help save the life of an adult, a teen, or a child who needs cardiopulmonary resuscitation, also called CPR. Cardio means heart, and pulmonary means lungs. Cardiopulmonary resuscitation can help a person whose heart has stopped beating and pumping blood. Giving CPR and using an AED give a person in cardiac arrest the best chance of survival. AED stands for Automated External Defibrillator. If one is nearby, you should use it when you give CPR. The first method you're going to learn is called hands-only CPR, which means you only have to give compressions by pushing hard and fast in the center of the chest on the breastbone. You don't have to give breaths. Picture yourself giving someone hands-only CPR. The person is lying on the ground in front of you, and you're pushing hard and fast in the center of the person's chest. What is CPR doing to the body to help keep the person alive? Try to visualize how you think CPR is helping save this person's life. When you give compressions during CPR, you're acting like the heart, helping to push oxygen-filled blood to the brain and the rest of the body. This can help someone survive when his heart stops beating. You've probably heard the terms heart attack and cardiac arrest before. You might think a heart attack and cardiac arrest are the same thing, but they're not. In fact, there are some very important differences. The major difference between the two is that during a heart attack, the heart is still beating and pumping blood and the person is still alive. When the heart stops beating, the person is in cardiac arrest. During cardiac arrest, the heart has stopped beating and the person doesn't respond and isn't breathing normally. A heart attack occurs when a clot forms in a blood vessel carrying oxygen-rich blood to the heart muscle. When the heart doesn't get enough oxygen from the blood, the muscle starts to die. A person having a heart attack needs immediate medical treatment. If the blocked vessel isn't reopened quickly, the muscle normally nourished by that vessel begins to die. Typically, during a heart attack, the heart continues to pump blood, so the person doesn't need CPR. The longer the person with a heart attack goes without treatment, the greater the possible damage to the heart muscle. Occasionally, the damaged heart muscle triggers an abnormal rhythm that can lead to cardiac arrest. Heart rhythm refers to the sequence or pattern of heartbeats, whereas heart rate refers to the number of times the heart beats in a minute. Anytime the heart stops beating, it's called cardiac arrest. A heart attack isn't the only thing that might cause cardiac arrest. Problems such as severe injuries, drowning, and drug overdose can also cause cardiac arrest. Just remember, when a person's heart stops beating for any reason, that person needs CPR immediately. You might think cardiac arrest happens only to older adults, but the truth is, cardiac arrest can happen to anyone. It can happen to a young athlete, a family member of any age, or even a child or an infant. It's really scary to see someone whose heart has stopped beating. But if you phone 911 and start CPR immediately, you can help save that person's life. Don't be afraid of doing something wrong. This video will help you learn what to do so that you can give CPR and save a life. We're going to teach you exactly what to do. The first step is to make sure the scene is safe. Look around you to make sure you aren't in danger. Next, tap the person on the shoulders and shout something like, "Hey, are you okay? Are you okay?" If the person doesn't respond, you need to get help. Shout to see if anyone is nearby. Say something like, "Help! Somebody help me!" If someone arrives, tell that person to phone 911 now and get an AED if one's nearby. If no one comes to help you, you will have to phone 911 yourself. If you have a mobile phone with you, phone 911. Use the speaker mode while you talk to the dispatcher so that you can have both hands free to start CPR immediately. If you don't have a mobile phone, leave the person to phone 911 and get an AED yourself. The dispatcher will ask you some important questions, such as, what's your exact location, so she can send help quickly and to the right place. If you're calling from a mobile phone, be very specific about your location so that medical help can find you easily. Don't hang up the phone unless the dispatcher tells you to. The dispatcher should help you remember and guide you through the steps of CPR and how to use an AED if one is available. Once you've called 911, you'll need to check if the person is breathing normally. Check for breathing for at least 5 but no more than 10 seconds. Look at the chest to see if it's rising as he breathes. If you see the person gasping, it's important to know that this isn't regular or normal breathing. A person who gasps usually appears to be drawing air in very quickly. He may open his mouth and move his jaw, head, or neck. Gasps may appear forceful or weak, and some time may pass between gasps because they usually happen at a slow rate. The gasp may sound like a snort, snore, or groan. If a person who doesn't respond isn't breathing normally or is only gasping, it's a sign of cardiac arrest and the person needs CPR. In your lifetime, you may have to perform compressions on a real person, acting like the heart and helping to push oxygen-filled blood to the brain and the rest of the body. Your quick and confident action can help someone survive when his or her heart stops beating. We're going to teach you how to give high-quality compressions. Watch first, then you'll get a chance to practice. Before giving compressions, make sure the person is lying on a firm, flat surface like the floor. To give compressions, kneel beside the person's chest. Move the person's shirt out of the way so you can see where to put your hands. Put the heel of one hand in the center of the chest, on top of the breastbone, and put your other hand on top of the first. Keep your hands in the center of the chest and push hard straight down. Make sure to push the chest down at least 2 inches. Push fast at a rate of 100 to 120 compressions per minute. Let the chest come back up completely after every compression. If you bend at the waist and keep your arms straight, you can use the weight of your upper body to compress deeply. Keep giving compressions until the AED arrives, medical help takes over, you physically can't continue, or the person starts to respond. Giving CPR right away increases the chance that a person will survive a cardiac arrest. You've learned that it's important to get an AED if one is nearby. Now, let's discuss why. An automated external defibrillator, or AED, can be used to treat cardiac arrest by delivering an electrical shock. An AED reads or analyzes the heart rhythm and then tells you if a shock is needed. Many airports, shopping malls, workplaces, and other public places now have AEDs you can use to treat cardiac arrest. If one is available, have someone phone 911 and bring you the AED. AEDs are often mounted on walls and have visible signs posted near them to help you locate them. By the end of this section, you'll be trained on how to use an AED. Using an AED is safe. It can't shock someone unless he or she really does need it. You only need to remember to turn it on and follow the prompts. Once you turn it on, the AED will tell you everything you need to do. Some AEDs will turn on automatically when you lift the lid. Others will require you to push the on button. After that, just follow the prompts you see and hear. Attach pads to the victim's bare chest. Some AEDs have both adult and child pads. For children 8 years of age and older, use the adult pads. Plug in pads connector. Analyzing heart rhythm. Pause to let the AED analyze. Loudly state, "Clear," and make sure that no one is touching the person. Shock needed. Loudly state, "Clear," and make sure that no one is touching the person. Then, press the button to deliver a shock. Shock delivered. If an AED is available, use it. It's safe and easy, and it can increase the chance of survival for a person who is in cardiac arrest. If you send someone to get an AED, ask the person to use it immediately while you continue giving compressions. Tell the person to turn it on and follow the prompts. It's time for you to practice compressions. Although we're just practicing today, you may need to use these skills in the future to save the life of a family member, a friend, or even a stranger. Put Minnie Ann on the floor and kneel beside her. Put one hand on the center of Minnie Ann's chest, and then put your other hand on top of the first. Keep your hands in the center of the chest and push straight down, hard enough that you can hear Minnie Ann click. Now, listen to this beat. The beat is telling you how fast to push. Compress to the beat. If you're pushing hard enough, you'll hear Minnie Ann click. Keep compressing to make sure that you know how hard you need to push. If you can't make Minnie Ann click, that's okay. Just push as hard as you can. Making sure you push the chest down at least 2 inches. You should hear the click each time you give a compression. Push fast at a rate of 100 to 120 compressions per minute, and let the chest come all the way back up after each compression. First, make sure the scene is safe. Next, tap and shout. "Hey, are you okay? Are you okay?" If the person doesn't respond, shout for help. "Help! Somebody help me!" Phone 911 and get an AED if one is available. You, phone 911 now and get an AED. Check for normal breathing. Begin compressions. You're going to practice giving compressions for 1 minute. Follow along with the beat. Push down at least 2 inches. Listen for the click. Let the chest come all the way back up after each compression. Keep giving compressions until the music stops. If you can't push hard enough to make Minnie Ann click, that's okay. Just keep pushing down hard on the chest and keep trying. In a real emergency, you'll give compressions until the AED arrives, medical help takes over, you physically can't continue, or the person starts to respond.